Okay, we'll go ahead and get started. So this is Whiplash Care, and we'll go ahead and start talking about things. First of all, the first thing to talk about is I am obviously super thankful that you have the opportunity to come in and take a look at some information about Whiplash Care. Hopefully this will be able to help you out. A little bit of information about me. My name is Dr. Bryan Royer. I have a couple of different certifications. One of them is that I'm a board certified functional neurologist. I also have a specialty in sports medicine. There's a couple other things, including like the corrective exercise specialist. I'm certified in Cranston technique as well as kinesiotaping, and I teach at a local community college around here with anatomy and physiology. But if you have any questions on here, feel free to go ahead and type them in the chat box, and I'll try to do what I can in order to respond. So that's basically that. So the first thing that we're going to talk about, or what we'll start here, is the whole idea is that what is whiplash? And so whiplash in and of itself ends up being a very painful type of an injury. It occurs when the neck and the head are suddenly forced backwards into hyperextension. So when the neck ends up getting pushed back and then it gets flipped forward into hyperflexion. That rapid motion is going to put that spine into extreme stresses, then it's often going to get an injury. And then typically the medical term for that ends up being cervical acceleration deceleration syndrome. So CAD syndrome is one of the things that we refer to it. Sometimes people call it WAD, so WAD for whiplash acceleration deceleration, but that's an older term that was used. So the cervical spine is kind of a complex type of an area. The spine itself is going to be super complex because it's made up of lots of different types of organ systems and tissues within the body. So again, it's well engineered. You end up having bones, nerves, muscles, ligaments, tendons, all of those kind of things are going to be going on in through there. It's going to, cervical spine will start up at the top of the skull, and then it's going to move its way down up into the thoracic spine and into the upper back. But the thing to remember is that that cervical spine is going to end up being very flexible in order to allow all the movement that it has. And that's something to remember. Again, the ability to move all the way left and right and up and down and the lateral flexion type of movements that we have, all of those are, you need a lot of flexibility in that, unlike in the thoracic spine that doesn't have very much range of motion to it. The cervical spine is also going to hold on, and it's going to house and protect the spinal cord, which is going to be responsible for sending messages from the brain and the spinal cord itself out to all of the different aspects that we end up having in the body. So the other thing is that, you know, with that flexibility, because you have the flexibility that's associated with the neck, you also have to have some stability with that as well. There's always a give and take in the body. When something is really flexible, then you end up having to need stability from the muscles. If something ends up having stability from the way that the joint is made, then it doesn't need as much of it from the muscles. So like the hip is made so that it needs to be, it's really stable from the standpoint of the way that the joint is made. So it doesn't need a lot of muscular stability. But the shoulder, on the other hand, is going to end up being something that the way that it's made, it needs muscular stability for it to actually operate the right way. But when it comes to the neck, again, you need this stability that's there, and it's going to be responsible for lifting something that's like a 10-pound bowling ball, or contracting to stop its movement. So as opposed to picking it up and moving it around, sometimes it's trying to keep the neck stiff in where it's supposed to be so that it doesn't move around because it has this big weight on the top of it. So the cervical spine is going to be complex. It's going to be intricate. Again, you can end up having a lot of different painful conditions that can have because of that complexity. And then there's stresses that can be placed on the neck from just normal everyday types of activities. And then obviously there's major traumas as well. But let's take a look at some of the symptoms that you can have that's associated with whiplash. The most common symptom that you end up getting with whiplash is going to be neck pain. And that pain is going to be something that can be very mild, but it can also be excruciating. And there's other symptoms that happen with it. One of them is going to be neck stiffness. So you can have neck pain, you can have neck stiffness, you can have more pain when you have movement of the neck. So when you start to check or look over your shoulder or different stuff like that, you can end up having more pain associated with that. Loss of range of motion of the neck, so you can't look as far as what you normally did. Headaches starting at the base of the skull, and even headaches that are up in other areas as well. Tenderness or pain in the shoulder, in your upper back, in your arms. Even people that have whiplash issues can also have stuff that's a low back issue as well, but that's usually caused from something else. But so that's one thing. But you can also even have numbness, tingling down in the arms and other kinds of stuff like that. The symptoms can be immediate, so they can start right after the accident, but a lot of times, like again, if it's an auto accident, or if it's a fall or something like that, things can be immediate, but sometimes they might not present for several days or weeks after an accident. So it depends on the situation. But the thing is that whiplash is not just about neck pain, because it's something that also can occur a lot of times along with a concussion. So let's take a look at that. So when it comes to concussion, the most common cause of concussions in adults are going to end up being motor vehicle collisions, and we'll talk about those more later. But a concussion is going to have certain symptoms that goes along with it. Headache is an obvious one. Again, neck pain and other kinds of stuff are associated with the pain. But then you can also have issues with dizziness. You can have issues with nausea, fatigue, sensitivity to light or sound. There's emotional components that can be there as well, where you can have a problem with irritability, sadness, and depression. Nervousness can be associated with it. And you can also have problems with confusion or issues concentrating or issues remembering. Not only the event itself and have issues with amnesia, but then later on afterwards having, remembering what you just did. Visual problems can be associated with it, as can balance problems. Again, all of these things are going to need rest and proper care to make sure that they don't become a chronic issue and become something like a post-concussion syndrome. So there's certain ways that you need to make sure that you treat this appropriately. So the causes of whiplash, again, we already talked a little bit about it, but the causes of whiplash are going to be from anything that's going to make the neck jerk suddenly and have that certain sudden type of movement. So again, any impact or blow that causes the head to jerk forward or backward. And again, there's other things that can happen with it. Again, you can get neck strains from being jerked side to side, but it's not typically known as whiplash when it comes to that, even though those can cause neck issues as well. Whiplash is a colloquial type of a term. So again, it's kind of like used in specific kind of situations, but some people have very specific definitions of it. So you can call it one thing or another. But to remember that these injuries can occur from like a physical assault, or something like being punched or being shaken, contact sports or sports related type of collisions. So tackle football would be an example, or setting a pick in basketball could be another example. And then the most common cause of whiplash would be accidents. So motor vehicle collisions or a rear end collision is most specifically associated with developing whiplash and the way that it actually happens. So there's a couple of different things that are in there. So when it comes down to it, again, auto injuries are going to be a big deal when it comes to that. So there's a couple of things to it, and we'll talk more about the mechanisms here in a second. But the thing to remember is that there's a couple of things that you should do in a collision. There's things that are associated with getting better, but then there's also things that are associated with making sure that you're basically protected from multiple different levels. But remember, I'm not an attorney. This is not legal advice. This is not anything that's like that, but I want you to just make sure that you're aware of a couple of things to do. So the first thing is that you never want to leave the scene of an accident. But then again, you also want to make sure that you're not in danger. So after an accident, you need to make sure that things aren't in the middle of the road and in danger of being hit by somebody else. So you can leave things in place that are damaged, but you want to get out of the way to make sure that you're not going to end up getting hit by another car or something else like that. If there are any types of injuries, then you want to either render first aid or call 911 and do your best in order to provide assistance to the people that you can that might have been injured in that collision. You always want to exchange your information, but you also want to document what happened. You need to make sure that, you know, like again, you can write down the person's information, their driver's license and the insurance card, but even better is to use your phone in order to take a picture of the other person's driver's license, of the other person's insurance card, front and back of both of them. The other thing would be to even take a picture of the other person. You know, and I'll talk a little bit about that in a second. But you also want to take photos of your car and any damage to your car, the other person's car and the damage to their car, any other property that might have been damaged, anything that was around that might have been hit. And then you want to get contact info for any witnesses that might have seen it, just so that they can, you know, tell what happened, you know, so that you actually have somebody else besides yourself that can say something either to the police or that they can say something for the insurance companies later on. Again, filing a police report would be something that you would want to try to do to try to get the police there so that you can file the police report, because those are usually going to be something that you would need with insurance eventually. And if you don't get the police to come, then you're going to have to go and file a report, typically wherever the accident actually occurred. But again, that medical treatment, again, you need to do that as needed. So either 911 right away for yourself, again, and other people, but later on, depending on it, you know, people might have problems later on in the day or the next day, depending on what's going on. You may need to go to the ER, you may need to go to urgent care, or you can always remember to give your friendly neighborhood chiropractic physician a call, and we can also work things out that way too, depending on obviously what your signs and symptoms are and what you're comfortable with. So those are a couple of things to just kind of remember. But again, when it comes to these, you know, that's what happens during the accident. After the accident or after the collision, you need to make sure that you notify your own insurance company, and you need to kind of go from there in order to take care of your vehicle. There's a lot of confusion that happens when people haven't had this happen before. You need to figure out whether or not it's your insurance that's doing it or the other person's insurance. But remember that when it comes to taking care of your car, you don't typically need to you don't have to take it to the places that the insurance company recommends. Oftentimes they will use cheaper parts, and they cut corners to an extent in order to make sure that they get the referrals from the insurance company. So those are a couple of different things that are with there. So, and then the other thing to think about is afterwards is to, you know, whether or not you should contact a personal injury attorney in order to help you out. So we're going to talk about that real quick here. So the thing to just think of is that when it comes down to it is that you have to be aware of the insurance company whenever you're dealing with this kind of situation. Insurance companies, even sometimes your own insurance company, isn't necessarily always on your side, because it's a medical legal kind of a situation, because attorneys can be involved, people can be sued, there's other kinds of things that are there. Now remember, I'm not an attorney, this is not something that I'm telling you to do, and anyway, I'm just bringing up a couple of ideas to make sure that you're kind of aware of them. So regardless of the situation, anytime that you're talking to anybody about any of this, is that you always want to tell the truth when you're dealing with the things about the car accident. Again, if you're talking about certain things with, you know, obviously the police or obviously with the insurance company, and you're falsifying information, you could get in trouble, and that could even include jail time. So you have to be careful about that kind of stuff. You also want to be careful about discussing your case with anybody, you know, like anybody besides the police, besides your own insurance company, and besides your attorney, if you have one. You want to be careful about discussing that with other people. Again, that's just one of those kind of things where there's specific things that you need to look out for. Not everybody is going to be looking out for your interests. Again, the representatives from the other insurance company may try to contact you about the accident, and you need to be careful with what you say. I'm not saying that you shouldn't talk to them. I'm not saying that you should. It's one of those where it's kind of up to you, but you don't absolutely have to, as far as I understand. And again, that would be something that an attorney would be there. you can always direct them to talk to your attorney. You can always direct them to talk to the other insurance company, to your own insurance company when you're talking to the other person's insurance. But anytime that you do talk to the other insurance company, you just need to assume that you're being recorded. Usually they'll tell you when you are, but you always have to be aware of that. Sometimes they will try to trick you, and there's other kinds of stuff like that, so you just have to be careful. So the other thing that causes an issue with this is that thing that I talked about with concussion is that a lot of times after an accident, people have confusion. There might be problems with concentration or problems with memory, or the nervousness of being injured and then trying to get your car fixed. So there's a lot of things that kind of go into it. So you need to just be kind of careful about all of the things that kind of go with that. Now, when it comes to whether or not you need an attorney, that ends up being a different kind of a situation. And again, I can't tell you whether or not you do or not, but again, this is something that it's not a legal advice type of a thing, but it's one of those kind of things that it depends on your situation. So to give you an idea is that a lot of personal injury claims don't need to have legal representation. So if, for example, if there's only damage to your car, and you're okay, then you probably don't need an attorney, right? You may not, it depends on the situation. A lot of times you can go through your own insurance and then deal with stuff, or sometimes you can go through the other insurance. So it just depends on how things are set up with that. A lot of times the way that I personally have handled it in the past is that I've gone through my own insurance when I've been in a motor vehicle collision. But again, that's not saying that that's the way that you have to. Again, if there's only minor types of soft tissue injuries that are involved, then a lot of times you can handle that on your own. It depends on how comfortable you are, really, when it comes down to the whole thing. A lot of times those minor injury claims get settled without a problem, and it's in a short time, and they don't really often result in lawsuits, but it just depends on the situation. So you have to be careful with it. You have to make sure that you are taking care of things, but because you don't want to be left with outstanding bills with it. But again, a lot of times this stuff ends up being straightforward, but again, the way that it comes down to is that it is up to you to determine whether or not you feel like you need an attorney. Are you comfortable with it? Right? It would be justified to get an attorney if you felt like the insurance company was being difficult, or if somebody was trying to trick you, or if there was a major type of a medical thing, like if you were hospitalized or you ended up needing an MRI, or there was like a herniated disc or different stuff like that. Those are all things that are going to be kind of more major. Or if the case is more complicated. So if there was like other motor vehicle collisions, or if you ended up having, you've had neck pain a lot in the past, then that ends up being something that ends up being more complicated, and you might get a little bit of a fight for that. So you kind of have to be aware of what's going on. So those are a couple of things that are associated with that. Now, that's the general kind of stuff. Now let's talk a little bit about what happens like in an actual accident. And this is, the first one is like a video, or it's a view of what happens. And there's another picture that's in a second that I'll show you what's going on. But let me get a little bit, let me get something here so that I can use this to kind of point at what I'm trying to look at. So when you end up sitting in this position, again, with your head forward and everything like that, you get hit and the car gets hit. And then the thing that hits you first is the seat that you're sitting on. So you don't get hit anything else. Your butt basically starts to move forward, right? You start to move in this direction. And when you start moving this direction, you end up getting it directed into your back. So that's why sometimes people will get low back pain issues after they get into a car accident, because they end up getting hit in the back and basically in the butt, for lack of a better term, first, and it can cause a strain in the low back. But this is an example of what happens here, where somebody doesn't have the head restraint in the right position, where they can actually bring their head over top of it, and that can tear a lot of stuff deep down inside of the neck, and that can cause some problems. Again, when that comes forward, after it comes forward like this, you end up having it come forward, the body comes forward, and then the neck flexes. So this is the hyperextension, or the extension that way, and this is the hyperflexion type of injury that can occur. So this is a little bit of a different, sorry, let's go back here. So again, you end up getting a couple of different things. So looking at this one, when it comes to this, again, the same kind of thing. What happens initially is that the mechanics of what happens with the collision is that once you get hit forward, you also end up getting a compression that happens in the cervical spine at the same time. So the cervical spine ends up getting squished because your head stays still, and then when your buttocks get moved forward and your low back gets moved forward, you end up getting a compression that happens in that cervical spine. Then you end up getting the head extending, and then you end up getting the snapping that happens. Again, in this position, everything is being stretched out, and muscles will fire in order to try to stop you from extending all the way. So that's where you can get muscular damage, but you can also get damage to ligaments as well in that hyperextension type of phase. Then when you move forward, again, it's the same kind of thing, the muscles in the back of the neck. So this is going to strain muscles in the front, and the soft tissue and the vertebrae that's in the front. Whereas when in this instant, you're going to strain things that are going to be in the back of the neck, and you'll strain the posterior capsules of the joints as well. So there's a lot of stuff that can happen with all of that. So again, the head rebounds off of the seat, it rapidly whips forward, and it injures the soft tissue in the back of the neck. And again, this is something where it doesn't take a lot of things in order to cause this. It doesn't mean that there needs to be a lot of damage. You can have things that can happen where people can get injured in accidents where the vehicles together are moving less than 5 miles an hour. So there's a couple of different things that can happen with that. Again, there doesn't need to be massive damage to the car. That's something that an insurance company often argues, because it's one of those kind of things that people think that if there's not damage to a car, that there's not going to be damage to a person. But again, the car is going to be moving at a certain speed, and the car moves, but the idea of the whiplash is the speed of the head moving is what causes the injury. Again, you have this giant melon, right? This bowling ball that's sitting on top of the head, and you end up getting that fast motion that happens. And again, it happens really, really quick. That's what causes the damage. It's not just, it was moving a little bit. Because there's all kinds of other physics that are associated with it. So when it comes to the recovery from whiplash, again, most of the time you can get recovered within a few months, but sometimes you can have cases that can last for several months or even years. And a lot of times it happens when it's not handled right from the beginning. So seeking treatment early on after an injury is going to be recommended in order to improve the effectiveness of the treatment, but also to make sure that things don't last and become chronic and bother you for years and years and years. So certain things will impact recovery times and make it so that it's longer. For example, if after a collision, if the pain is very, very severe at the time of injury, then that's going to increase the likelihood for the recovery time to be longer. Again, if somebody had post-traumatic stress disorder as part of that, that can increase it. If somebody was in older age when they were in the accident, that could increase it as well, because things would be stiffer and more likely to get hurt. And the other thing that ends up happening is the gender can play a role in that, where women can end up being more susceptible, typically because the musculature of the neck, this is the same thing with concussions in female sports, are usually higher. And the reason why is that because the musculature in the neck isn't able to stabilize the head as well as what it could. So then therefore, there ends up being more likelihood of getting the actual whiplash injury. And basically, in order to prevent it from becoming a chronic issue, you need to make sure that there is a proper evaluation. So what it comes down to is that you need to make sure that you have the right type of diagnosis. And the way to have the right type of diagnosis, that can become kind of complex, because there's no physical specific sign for whiplash. You can't do a test or do an MRI or a CT and specifically say that this is whiplash. There's certain things that you can see, like, extra swelling and other kinds of stuff like that, but there's nothing that says that this is definitely a whiplash kind of a thing. So the way that you need to know is that you do it by the history and you do it by the exam. So again, you do a full patient history. Again, in our office, when somebody comes in, that first visit after an accident takes a long time because we need to do a full history, prior things that have happened. We need to do family history. You need to find out about pre-existing conditions. And then you have to do in-depth questioning about the current symptoms that the person has. Then you need to do an in-depth physical exam. And again, the exam will start, you'll do postural exams. You'll take a look at tightness and tenderness that happens. You can test the mobility of the neck. There's certain things where you can do orthopedic testing where you can push in different areas in order to put pressure in different areas of the neck. So there's other things that are associated with that. You also need to do reflexes, test the muscle strength, test for sensation. Sometimes, depending on the issues and how long it's been going on, somebody might need to get an EMG or an NCV, which is a specific type of test that shows whether or not the nerves are working correctly. And then sometimes fractures are suspected or there's other neurological issues. So you might need to do other types of diagnostic imaging, whether or not it's an X-ray or an MRI or a CT scan. And sometimes you might wait to do some of those and do the test later on, depending on what's going on. So there's all kinds of different things that are associated with it, but the diagnosis is really important to make sure that you get right. So there's a couple of different classifications of the whiplash associated, or the whiplash acceleration and deceleration types of syndrome or injuries. So there's basically a couple of different levels to it. The first one is a grade 0, and a grade 0 is somebody that was in a collision, but they don't have any signs or symptoms. Grade 1 has neck pain, stiffness, or tenderness, but there's no problems with range of motion, no problems with loss of strength or swelling. Most commonly, people will have a grade 2, which is a neck pain, stiffness, and tenderness, and problems with range of motions. They might have loss of strength or swelling as well, but usually the limitation in range of motion is there. And then there's also issues with a grade 3, which is anybody that has a grade 2 symptoms that has neurological signs. So again, having that the specific types of muscle weakness or numbness and tingling or different kinds of stuff like that can be associated with a grade 3. And grade 4 is going to end up being somebody that has neck complaints after having a trauma that's associated with a fracture or a dislocation. Obviously, that is the most severe kind of stuff, and that would be something that in those cases you're obviously not going to be adjusted for, at least not initially while that's healing. There's multiple different treatment options that are available depending on the severity of the whiplash that a person has. Again, there's a bunch of different self-care treatment options and other types of things that we might take a look at. So let's take a little bit of a deeper look here. So again, there's multiple different injuries that can, multiple different things that can happen with that. But the first thing to talk about here is going to be chiropractic care. Chiropractic care is going to focus on disorders of the musculoskeletal system and the nervous system, as well as the disorders' effects on general health. Again, you can use chiropractic care in order to help with a number of different ailments. Again, back pain, neck pain, pain in the joints, arms, legs, headaches. Again, it doesn't matter if it's a foot or a hip or a neck or a low back. Chiropractors treat all of those things. Again, there's multiple different broad diagnostic skills, especially in this office. We do thorough exams, thorough histories in order to recommend the correct kind of therapeutic and rehabilitation types of exercises, look at nutritional factors, dietary factors, lifestyle counseling, and things along those lines. So again, multiple different things with diagnosis, examination, and treatment are things that we can do. So we also do exercises here in the office. So in our office, we'll also be doing things with corrective exercises. So things to inhibit muscles that are too tight, stretch out and lengthen muscles that are too tight as well and too short. Strengthening the muscles, and, making sure that there's enough endurance in the muscles are all things that we would be doing in the office. So one of those things that happens when it comes to all of this is that there's certain things that happen with muscle strength. So we're going to take a little bit of a deeper look here on this picture. So this picture here is going to end up showing the muscle, right? And this is what a normal muscle looks like. You can see how there's different separations that happen. Those are called fascicles. And again, you can see the lines as they're going back, and there's these fascicles are made up of multiple different muscle cells. Now, when it comes down to getting injured, You get an injury that's associated with this, and basically what will happen is that you can see that there's a lot of swelling in through here. So the swelling that's going to be associated with that injury, again, there's going to be blood rushing into the area, there's going to be damage, there's going to be possibly tearing of some of those fibers, and some different issues that are going to be associated with that. So this is going to be what happens with a soft tissue injury, where you end up getting problems with the muscles. A strain is going to end up being a tearing of that muscle to some degree. The worse off the strain is, the more tearing that's going to end up occurring. You know, it could be like a stretching for a milder version, but you can end up getting tearing that can happen with that as well. So if we're looking at this, and this is just moving the one up a little bit so you can still see the swelling that's there, after something like this heals, a lot of times scar tissue is going to be something that will actually result. So this is an example of what can happen after this area that's swollen heals. The body can try to add extra tissue to the area in the form of scar tissue in order to strengthen it and make it so that it doesn't get damaged as much before. The problem is that this scar tissue can also be something that ends up being problematic. So that the problems that are going to be associated with those things, again, there's a couple of different issues that are associated with that. So the scar tissue can cause a restriction in the range of motion. It can be painful in and of itself. What this doesn't show you is that there's levels of fascia that are going to be existing in through here. So there's fascia that lays on top of it, and there's a couple of different layers to it. It can go all the way up to the skin. So this is something that can cause pain with people. So because of that, one of the things that we do in this office is something called Graston technique. So Graston technique is basically going to be where you use these metal tools that you see here on the screen, and the metal tools will basically dig into the skin and help to basically break up scar tissue. It does it to allow things to slide and allow things to move better, and it helps to reduce pain and restore function. So it also helps to find where people end up having problems, because you can also detect the areas of scar tissue that you end up getting with it. So it can help treat the muscles, the tendons, the ligaments, and all of those different things, and help them to heal properly. Again, associated also with the exercises and stretching and strengthening that we're doing in other types of areas. So another thing that can be associated with this scar tissue, but also the muscle pain and everything in general, is massage therapy. Massage therapy is a great type of treatment that can be used along with the manual adjustments in order to help to relax the muscle tension and increase blood flow, helping to decrease the tension in the muscles and improving the flexibility, endorphin releasing, again, helping with stress. So there's a lot of different things that are associated with it. And then again, in this office, we also offer massage therapy as one of the treatments for people that end up being in a motor vehicle collision. So, you know, depending on how serious everything is, sometimes people, that's an appropriate type of treatment. There's also self-care type of treatments that you can use for some of these musculoskeletal type of complaints. Again, making sure that you're resting. Again, ice or heat can be some of the things that you can use in order to help with whiplash injury. Sometimes people like ice better, sometimes people like heat better. There's arguments that happen back and forth within the musculoskeletal medicine type of world with physical therapy and chiropractic and all that. But usually the way that I look at it is that after an injury, you want to, you know, try to use ice at the beginning, but again, you can use a little bit of both. And I wouldn't necessarily always call somebody wrong if they wanted to heat it, especially if the heat felt better and if it helped to decrease their pain. There's also over-the-counter medications that people can take for it. And we'll talk a little bit about that here in a bit. So again, needing rest and proper care to make sure that the issues don't become chronic. This ends up being an issue with the post-concussion, with after getting a concussion. There's multiple issues that are there. So this is a treatment types of things that I do in my office that are a little bit different than what other people get in other offices. So you end up having this issue with functional neurology is something that I do. So I'm a board certified functional neurologist. I do brain-based rehab type of things with people when they have some of those issues with concussions. Again, if you're having problems with things being too loud, or the light bothering you, or getting problems with balance. Those are all issues that you may need to get treated extra for. This might be something that chiropractors that don't have the extra specialized training that I do might have issues actually treating. So the issue with this is that, again, you need to have that right kind of rest and the proper care in order to make sure that it doesn't become a post-concussion syndrome. But the thing about concussions is that there's no actual treatment for concussions. There's no medications that you can give for somebody to treat the concussion. Sometimes you can manage things like nausea or dealing with the pain meds for the headaches and stuff like that, but that's about it. So what we're going to do in our office for somebody that has a problem is that we would identify any neurological deficits that they might have. We try to objectively measure the neurological function to make sure that things work as they should, or find out what isn't working. We understand that relationship between the different neurological systems better because of the extra training that we have in neurology. And we also are going to use different types of strategies in order to target and help to restore normal function. And again, sometimes that can involve adjustments, but a lot of times that's going to be too much for people. That can involve sensory information, eye movements, balance exercises, having the person do specific types of movements. So it depends on the person. And the thing about it is that you can't do a cookie cutter approach in order to actually make sure that the joints are working the way that they should, or make sure that the brain is working the way that it should. There's a couple other options that we have here. We also have acupuncture. Acupuncture can be something that can be helpful. So can dry needling. Again, a lot of people get pain relief from acupuncture. Again, acupuncture is going to be placing tiny, thin little needles into different points in the body in order to help to stimulate the nervous system and to aid the healing process of the body. And the other thing would be physical therapy. So there's different options, obviously, going to physical therapy. They'll be doing a lot of the things that I've already talked about. Again, doing exercises, there's possible manual treatments that can be there. Something that happens with physical therapy that you're not going to get in this office for sure is in some offices, they actually have things that would be based in a pool. So water-based physical therapy would be something that is another option that people can have. So there's a couple of different things that are out there. Now, one of the things that's associated with all of this, again, like I mentioned, is pills. Pills are something that can take care of maybe sometimes some pain in some kind of cases, but it's not going to help make the confusion go away, or the fatigue go away, or other kinds of stuff. So there's not really a lot of things that are directly treating the concussion. There's not really, at this point, there's not any specific types of blood tests or anything like that to let somebody know. But when it comes to treatment, again, medication can sometimes be used for symptoms, but not for much more. When it comes to injections, sometimes somebody can go to a medical doctor and they might recommend that an injection be given in order to target a specific type of troublesome type of spot. There are cervical epidural steroid injections that can be used. Those can be used to reduce nerve inflammation or tissue inflammation. If a person has a disc herniation, sometimes there are cervical facet joint injections that can be used in order to help give a little bit more relief in the joint. Trigger point injections can be used in order to calm down muscles that are irritated. And again, the goal of those injections is to help to relieve pain that's associated with the inflammation that's either around a nerve or muscles in the neck or such, in order to help to deliver the medication directly to it as opposed to taking a pill for it. The other thing that's a possibility is something that is called radiofrequency neurotomy. And basically what's going to happen is that you would take heat, and again, this is often going to be something that would happen in like a pain management doctor's office, is that they can use heat in order to basically burn the nerves in an area so that it will interrupt the pain signals and stop it from going up to your brain so that you can experience it. So if you can break the signal coming from the area, then you no longer feel the pain. Again, this is something that you don't use lightly. You want to make sure that you're failing conservative care first, but this is going to be one of the things that's a possibility. Again, surgeries are sometimes with people that have disc herniations. Those are going to be things that might be possibilities as well. But Going back to the conservative care stuff, again, home exercises are going to be something that, for the most part, we're going to be recommending for people to do at home, using different things to help to restore the range of motion, doing rotations of the head, or tipping your head side to side, or bringing your chin down towards your chest, moving the shoulders and doing the shoulder roll are all different options that you might have depending on how severe your pain is, because we don't obviously want to make somebody be in more pain than what they are. So there's a couple of different options that people might have. Sleep is going to be another thing that would be an issue. Again, if somebody ends up having bad sleep, then they're going to end up having a lot of problems on top of that. So, you know, a lot of times the issues with depression and anxiety and stuff like that are caused because the concussion, or because the injury is altering the person's sleep habits. They might have more pain at night, so they just can't get to sleep the way that they normally would. So, but when it comes to sleep, again, you want to avoid sleeping on your front, or you want to avoid sleeping face down. Because if you're face down, your head has to go one way or the other. And again, that can put an extra strain on the neck. So you want to have a firm, supportive type of a pillow that's going to support your head and support your neck. You don't want to use a bunch of pillows, because that would shove your head up to the side and stretch things out and cause problems. So there's all kinds of different versions of this. In our office, we use a pillow called a Chiroflow pillow. There's other ones that you can have as well. So, and again, you can use heat in order and apply that to the injured area to try to help relax the muscles, you know, before you go to lie down. You can try to hot shower. So there's a couple other things that you can do. We do have a YouTube video that's called "How Do I Optimize My Sleep?" And that would be something that you would also be able to take a look at and get a couple of other recommendations for how to fix sleep when that's problematic. Maintaining good posture is going to be a great thing to make sure that you reduce problems. So if you maintain a good posture, if it's good and it's upright, that can help to reduce stiffness and pain that's associated with whiplash. So making sure that you do proper posture. There's exercises that I have there is a video that is about treating upper cross syndrome. That's something that can help improve somebody's posture. So there's a couple of different things with that, but you want to try to keep your back straight while you're sitting and standing. You don't want to be standing and having this poor posture as well, because that's going to put extra stress on the neck when your head is forward like that. Again, especially if you are spending a lot of time using a computer, that's going to be something that you want to make sure that you're working on. Making sure that you adjust your screen if you're using a computer so that it's at the right level. You don't want it to be too low, so you're looking down at the computer. Making sure the chair's at the right spot. So that's typically something that you can look at online. You can Google workplace ergonomics and look at the images, and typically there'll be a bunch of different stuff that'll show up. So this is all different stuff to help to remind you to actually sit upright. So that is basically it for today. Again, if there are any questions, we can obviously answer it if you have any questions. And again, if you have anything below, go ahead and you can post something down below here on the video later on. And if you have any questions, let me know, or you can send me an email. The email would be health@harmonychiro.com. And I appreciate your time, and thank you very much for listening. I'll talk to you later.